Assalamualaikum and good morning. So my name is Nurkisa Sofia binti Rahman American. My matrix number will be 414-222-1021. I'm from School of Health Science, Diploma in Medical Imaging, Cohort 34. So topic of my case study, Imaging Technique 3 today will be barium swallow on the gastrointestinal tract. I'm from KPJ University and I'm currently on my 4th sem, second year. So Madam will be guide me into this case study will be Madam Nid Roslinda. So for our case study today, which is barium swallow on gastrointestinal tract, I would elaborate them into a few parts, which is the anatomy of the part, explanation on the suspected indication, preparation of patient, equipment, patient care, radiation protection, explanation of during procedure or post-procedure image analysis, diagnosis reports. And also I will put on my reference about all of this. As I just stated just now, we'll start our case study today with anatomy of the part. So I'll start off with our mouth. Our mouth is the beginning of the tract. It's where digestion begins. Mechanical digestion and chemical digestion start the breakdown of the food. Next will be our pharynx. Pharynx is a tube at the back of the mouth that serves as a passageway for food, liquid, and air. Next will be our esophagus, which is also a muscular tube but connects the pharynx to the stomach. It transports food and liquid to the stomach through a series of muscular construction called perithalsis. Next will be our stomach. Stomach is a hollow muscular organs that receive food from the esophagus. It continues the digestion process by mixing food with gastric juice such as acid and enzymes to form a semi-liquid mixture called chyme. So, we'll proceed our anatomy of the part and start off with small intestine. Small intestine divided into three parts, the duodenum, the jejunum, and the ileum. The duodenum is the first part where chyme meets with pancreatic zyme and bile. Jejunum is the middle part where most nutrient is being absorbed. Third, it will be ileum, is the final part of the small intestine and connects to the large intestine and absorb any remaining nutrients. Next is our large intestine, which is also colon. It consists of cecum, colon, and rectum. Cecum would be a pouch-like structure at the beginning where the small intestine joins. Colon is divided into four: ascending colon, transverse colon, descending colon, and sigmoid colon. These all absorb water and salt from the undigested material, forming solid waste, which we call as feces. So, rectum is the final section where feces are stored until they are eliminated through the anus. So, our last part of gastrointestinal tract will be anus. It's the opening at the end of the digestion tract where feces leave the body. So, to proceed, I will elaborate about explanation on the suspected indication, which is esophageal dysmotility. So, it's a condition where the muscle in the esophagus, the tube that connects your throat to your stomach, doesn't work properly. Normally, this muscle contract in a coordinated way to push food and liquid down to your stomach. However, when this process is disrupted, leading to difficulty in swallowing, chest pain, and sometimes even heartburn. So, this kind of condition can occur to various reasons such as nerve damage, muscle disorder, or structural abnormalities in the esophagus. It could be temporary or chronic. And treatment typically involve managing system through lifestyle change, medication, or in some severe cases, surgical intervention. So now we proceed with the preparation of patient before examination. So first will be explanation of the procedure. Patient should know the purpose of this procedure, how it will conduct, and the result that we expected from this kind of procedure. Okay, and then fasting. Patient have to fast overnight or 8 hours for better visual. Then medication review. We should make sure that any medication patient take doesn't affect bowel movement. And then allergy. So especially to barium or iodine. Next, we go to pregnancy screening. I know it's safe to do it, but precaution may need to be taken. Okay, most part is informed consent. So, we have to make sure that patient acknowledge the risk, the benefit, and the potential complication that we could get from this procedure. Last but not least is patient positioning. We as radiographer should provide clear instruction for the patient. Okay, so now one of the part most important for we as healthcare providers, which is patient care during the examination. So I'll provide 6 for today's. Okay, we start off with positioning. So position the patient to ensure they are comfortable and stable. Swallowing instruction, ensure they understand the timing and the quantity of the barium they need to swallow. Monitoring, continuous monitoring during the procedure for any sign of distress or adverse reaction. Be prepared to intervene if necessary. Safety measure, necessary safety precautions such as providing a lead apron to shield the patient from unnecessary radiation exposure. Communication, let them know what you are doing and what is expected of them. Encourage them to communicate any discomfort or concern they may have. Lastly would be comfort measure. Offer reassurance and support to keep the patient as comfortable as possible during the procedure. Provide pillows or any other aids to support them if needed. Okay, now we follow up the procedure with our radiation protection aspect that I provided, which is 7. So, first we start with optimizing equipment system, which is ensure the X-ray machine is properly calibrated and operated at the lowest radiation dose necessary to achieve diagnostic imaging quality. Shielding. Shielding is properly positioning lead apron or shield over sensitive areas, such as reproductive organs, to minimize radiation exposure to non-targeted tissue. Collimation. Use collimators to limit the X-ray beam to the specific area of interest only, to reducing unnecessary radiation to surrounding tissues. Patient positioning. Accurate positioning to minimize repeat exposure and achieve optimal imaging with the lowest radiation dose. Radiation monitoring received by the patient and the healthcare providers to ensure they are in safe limits. Education and communication. So we as radiographers should acknowledge the patient about the risk and benefit of radiation exposure and obtaining informed consent patient before the examination. Last but not least is qualified personnel. So performing the procedure under the supervision of qualified healthcare professionals who are trained in radiation safety protocols. We have reached one of the most important part of my case study, which is explanation during procedure and post-procedure. During procedure, I'll divide it into 3 parts: ingesting the barium, X-ray imaging, and swallowing techniques. So ingesting barium, they'll be asked to swallow a chalky liquid called barium. Depending on the test that being conducted, they also may be asked to swallow some effervescent granules to produce gas in your stomach, which helps to improve the quality of the image. X-ray imaging, be positioned under an X-ray machine in various positions. The radiologist will take a series of X-ray images as the barium moves through your digestive system. They also may ask you to hold your breath briefly during some of the image to minimize the blurring. Lastly, swallowing techniques. During the procedure, patient may be asked to swallow multiple times, sometimes with different consistency of the bariums. This helps the healthcare provider evaluate the function of your swallowing muscle and identify any abnormalities. Followed up by during procedure. Now is the explanation of post-procedure. So observation, as to wait while the radiologist review the image to ensure they have captured all the necessary information. Resuming normal activities, usually immediately after the procedure, but may be advised to drink plenty of fluids to eliminate the barium from your system. Potential side effect. Some people may experience temporary constipation or white color stool due to barium passing through the digestive system. Drinking plenty of fluids can help elevate this system. Additionally, if you experience any unusual symptoms such as abdominal pain, difficulty swallowing, or severe constipation, you should contact your healthcare provider immediately. Last but not least is the follow-up. Once the radiologist has reviewed the image, they will provide a report to your referring healthcare provider, who will discuss the result with you and recommend any further treatment if necessary. Okay, we have gone through all the procedure. Now I will show about our image analysis. I'll provide 2 sides, which is epibarium swallow and lateral barium swallow. So, by the image, we can analyze that incoming contrast start at the mouth, continues through the pharynx, esophagus, stomach, small intestine, and big intestine to the end of gastrointestinal tract system, which is at the anus. By examination, it could be detected that contrast material doesn't flow smoothly through the esophagus and delay esophageal emptying, indicating potential obstruction or narrowing. There are also abnormal esophageal constriction and inadequate lower esophageal sphincter relaxation. The contrast can flow down towards the gastrointestinal tract of the body because of the patient positioning, that is, standing. After going through all the procedure and image analysis, we're here now with doctor's report. So, based on doctor's report, the esophageal manometry study revealed abnormal esophageal motility characterized by impaired perithalsis and inadequate lower esophageal sphincter relaxation. Findings are consistent with esophageal dysmotility, including esophageal dilatation, retained food particles, and possible esophageal strictures followed by delayed esophageal emptying and abnormal esophageal contractions. So the doctor has suggested some treatments. Here are some common approach, which is medication, dietary change, lifestyle modification, esophageal dilatation, botulinum toxin injection, surgery, and behavioral therapy. It's important to work closely with a healthcare provider to determine the most appropriate treatment plan based on your specific system or symptom, medical history, and the causes of your esophageal dysmotility. Now it's already at the end of my case study. Here are some references that I get for this case study. Some of it is from the website on the internet, and some of it is from the book from the library. So now it's already officially the end of my case study. Thank you for your attention, and it's all from me now, Norkisa Sofia, for my case study topic, which is barium swallow and gastrointestinal tract.